Live from the WJTV 12 News Studios in Jackson, Mississippi, this is a Mississippi Town Hall, The Road to Normal.
And welcome back to The Road to Normal, a Mississippi Town Hall broadcasting across the state. We are still taking your questions for Governor Tate Reeves, State Health Officer Dr. Thomas Dobbs, and MEMA Director Stephen McCraney. Send them to use now by email, video, Twitter, and Facebook. Our address is townhall@wjtv.com, or you can use the hashtag AskReeves on social media. And we're still taking your input for 12 News Connect. Do you approve of the state's response to the COVID-19 emergency under Governor Tate Reeves' leadership? You can see some of the early voting on your screen. Vote now in our informal web poll. It's on our website and on our mobile app. We want to hear from you. Now, we'll check in as more of your questions come in. Now, here's 12 News' Byron Brown and our guest panel. Byron?
Melanie, thank you very much. I'd like to continue our questions here. Dr. Dobbs, start with you, but and get your answer to this question. Should we vaccinate children against COVID-19?
You know, we're still waiting to see the data from Pfizer, but it looks like they have strong data from 12 to 15 years of age, and already you can do it at 16. So, you know, for 16 to 18, we've seen the data. It's great. The response is wonderful. Yes. And for 12 to 15, the preliminary data looks like it's 100% effective, you know, compared, you know, preventing any disease. So if we want to get kids in school, let them have robust, youthful experiences and develop fully, this is a fantastic way to ensure that.
Governor, you support vaccinating children?
I do. I think that as we get more data, clearly the Pfizer studies between 12 and 15 are before the CDC and the FDA now, and I would expect that they will take action relatively soon on that particular data. And if they do, and they find it to be safe, then I think it certainly makes sense.
Something you support, Director?
Absolutely.
Governor, you've been criticized by some Mississippians for lifting the mask mandate. One viewer, Lakiva H., writes, why did he take the mandate away? And he, took note of COVID variants. What happens when new mutations take hold? Your response to our viewers.
Well, the first thing I would say is I've been criticized by a lot of people for a lot of the decisions that I've made over the last year. There has been no roadmap to dealing with a pandemic, the likes of which this country hasn't seen since 1918. And what I can assure everyone who's watching tonight is my biggest critic is the one who stares back at me in the mirror every single morning. And the fact is, we're trying to make the best decisions to protect as many Mississippians as possible every single day. With respect to the mask, first of all, Mississippi hadn't had a mask mandate statewide since the middle of last summer. We have utilized and looked at the data, making decisions to do county-wide mask mandates as the numbers went up. And so one of the challenges we have throughout this entire process is there are some, and particularly some of those in the White House, who want us to focus on the science and the data when the numbers are going up, and they want us to completely ignore the science and the data when the numbers are going down. In early March, when I made the decision to take all mask mandates off on a county-by-county basis because the data suggested we should do so, we had just less than 600 cases per day on a rolling 7-day average. Now, that was down at that time about 75% from our peak of 2,400 cases rolling on a 7-day average, or if you're looking at that, that's approximately 16,800 cases over a 7-day period. Since that time, in early March when I made that decision, and I was roundly criticized from everyone from the President of the United States all the way down, but since that time, our total number of cases have fallen from just under 600 cases per day to over the weekend and yesterday we were below 200 cases per day. So another 60% decline over the last 6 weeks in total number of cases. Our hospitalizations, our patients in ICU beds have likewise plummeted over the last 6 weeks. And so I'm very proud of where we find ourselves today, but I also recognize that if we can believe anything about this particular coronavirus is that we can't take anything for granted. We have to continue to look at the data. And at the end of the day, and people ask me, say, why do you know the data so well? Why do you spend so much time on specific data points? It's because every single Mississippian matters to me. And I know that every single time a Mississippian gets the virus, and particularly every time we lose a Mississippian to the virus, that's a terrible outcome for a Mississippi family. And so the data is important. We have to recognize that we not only have to make decisions to protect lives, we also have to protect livelihoods, and it is a balance, and that's something that I think we have understood from the beginning, and it's certainly not easy, but I think it's important. And I think 10 years from now, when history looks back, I think it will show that we have made more right decisions than wrong and more good decisions than bad. But every single decision we made was with the intent of helping Mississippians.
Dr. Dobbs, what was your initial recommendation when lifting the mandate was considered, and what was the data then and what is it now?
Yeah, no, the governor's absolutely right. I mean, we've continued to decline in our cases. There's just no doubt about it. And, you know, when we talked about it before, in the context where we were, the thing that was driving transmission was not people not wearing masks, it was social events. It was people having indoor things we're transmitting. So the real target really needed to be, and I think, you know, for a variety of reasons, it's worked out quite nicely. The governor's had a very strategic approach to putting them on counties if cases get out of control, and when they backed out, pulled out, and he stuck to his word, and it seems to have worked out, you know, quite nicely.
Was that something you agreed with? Were you in support of that decision, or were you not a supporter of that decision?
Oh yeah, no, you know, I'm in support of people wearing masks, and I think one of the things that was important is the strategy. And I know our discussions were very often is how do you get people to do it the best? And if you belabor people over and over again and say this is never going to come off, that maybe that's too much and then people are not going to respond to it properly. So whatever we can do to get people to take safety measures as much as possible, whatever the strategy is, that's what I'll support.
And let me say this, Byron, and Dr. Dobbs, again, has done a fantastic job. His entire team has. We haven't agreed on every single thing. At the end of the day, the individuals are in their positions. We have great, lively conversations and discussions, and the environment that I've tried to create inside that room, if you will, with him and his team, with General Bowles and his team at the National Guard, with Mac and his team at MEMA, is I want to hear everyone's opinion. And I want to know what they see as the pluses and the minuses to every single decision we make. But the one thing that I've been very clear about, not only to our team, but also to the people of Mississippi, is that we're going to be transparent. We're going to tell you why we made the decisions we made. And if we make a mistake, we're going to be willing to say, hey, maybe this didn't work out the way we wanted it to. We're going to take a different course of action. From the beginning, we had very objective criteria on how counties, individual counties, ended up with a county-wide mask mandate. That objective criteria was either 200 or more cases over a 14-day period, or more than 500 per 100,000 cases. The fact is, even in early March, the data did not justify more county-wide mask mandates because it had fallen so significantly from 2,400 cases per day to 600 cases per day. Since that time, over 6 weeks, we have been proven that that number continues to decline. It's gone from just under 600 cases per day to under 200 cases per day. And again, that's a good thing. We ought to celebrate that fact. We ought to be excited about that fact. We didn't just do it because of some executive order that I signed or didn't sign. Those numbers happen that way because of what Mississippians have done. It's because people all around the state in all 82 counties have continued to go and get vaccinated. Our vaccine numbers continue to increase. Look, I remember celebrating and really being so proud of the achievement when we had our first 100,000 shots in arms. Dr. Dobbs and Mac and I did a press conference, and it wasn't that long ago, just a couple of weeks ago, when we reached 1 million shots in arms. Today we reached 1.5 million, and that's something we ought to celebrate. We don't have to focus on the negative. We can focus on the good things that are going on, and all the numbers that need to be going up, i.e. vaccines in arms, are going up, and all the numbers that need to be going down are going down. Let's get another question from Melanie, who has a question from a viewer. Melanie?
Thank you, Byron. We do have another question about masking. One of our photographers in Jackson spoke with Angel T., who lives in Jackson. Take a listen.
How long will masks be staple and part of society in Jackson, Mississippi? Yeah, I'm just wondering because I wear my mask everywhere, you know, and I'm kind of afraid not to. so. I'm just wondering because I see a whole lot of people not wearing masks.
That comes how long will people, should they have to wear one, or should they wear one, or how long will we have be wearing masks?
You know, that's such a good question. And for right now, with the variants and some low-level transmission and everybody's not vaccinated, it makes sense for us to keep doing it. So we still advocate for people wearing masks in public. But we know that people who can get together in small groups if they're all vaccinated, right? And so I've actually got to see some of my friends, which is pretty fun for the first time in a year. A lot of it depends on the variants. At this pace, unless we get any variants that really sort of overwhelm our vaccine, and I think things are looking good, that we're not going to have a variant like that, at least not in the near future. I'll be hopeful by the middle summer that we're going to be saying, you know, maybe masks aren't needed at all anymore. That's where I'm going to be hopeful about.
What are the critical do's and don'ts for people who have been fully vaccinated now?
You know, wait until you've completed, until you're fully immune, right? So 2 weeks after your last shot, you're not really considered fully immune. You know, still operate with some care, right? Don't go, everyone shouldn't go to large indoor social gatherings, especially when people have masks on. Outdoor stuff is generally safe. I think that we've recognized that transmission is pretty low, especially if you're intermixed with people who are immune and vaccinated. And then just wear a mask in public. I mean, we all need to do that right now. I think the rules are going to be the same for everybody, except for if you are vaccinated, it's safer for you to visit your family members in the hospital, your family members in the nursing home, or we also know that you can have, you know, some small social gatherings and it'd be safe.
I think, let me say this, because Angel said something that I think was critically important. She said she still wears her mask because, well, she's kind of scared not to. And really, if you think about it, that's a personal choice that Angel is making. And we ought to give her the ability to make that choice. If she is uncomfortable and she feels more safe by wearing a mask, she ought to wear a mask. And that kind of goes to the philosophy that I try to take, which is I trust Mississippians to do what they think is in their own self-interest. And so if you can go and get vaccinated, and you can get your second vaccine if you're doing Pfizer or Moderna, and you can wait what is typically 2 weeks to get fully vaccinated, well then you put yourself in a position where I would argue that you have much more flexibility in terms of what you want to do and what you can do. So for me personally, you'll see if I'm indoors in a room full of a lot of people, you're likely going to see me wearing a mask. But at the same token, if I'm outdoors on the soccer field watching my daughter play soccer and there's no one within a few feet of me in either direction, you're probably not going to see me wearing a mask. And that's because I feel like because we are vaccinated, my wife and I are both vaccinated, we're in a position where we can do that. And so, again, be smart, take care of yourself, do the right things, protect yourself by getting vaccinated, and try to live your life.
Gentlemen, we want to talk a little bit about the financial and economic impact of this pandemic. For one thing, we see clearly that many Mississippi workers are vulnerable when it comes to access to affordable medical care. Governor, you are facing pressure from some corners to expand access to Medicaid here in Mississippi. A new ballot initiative, number 76, could give voters a direct say in whether we finally expand Medicaid. Here's an email question from Camille W., who describes herself as a fellow Rankin County and registered voter. Governor Reeves, why do you and your fellow Republicans continue to refuse to expand Medicaid in Mississippi? You're denying hundreds of thousands of workers, working Mississippians access to medical care. Your response?
Well, thanks for the question, Camille. I appreciate that. And Byron, you and I have sat in this same studio at least 3 or 4 times throughout the 2019 campaign and maybe even since then, and had this very conversation. And for me personally, my view has not changed. I have chosen to oppose expansion of Medicaid in our state because I don't believe the Mississippi taxpayers can afford it. You know, there are those who would have you believe that there's just some money tree, some pie-in-the-sky money tree where money's going to come out and pay the state's share. But if you look at actually what the Black Caucus in the Mississippi legislature proposed this year, they proposed and asked for an additional $150 million in state taxpayer money to pay for the state's share of Medicaid expansion. Clearly, they support Medicaid expansion, and that is certainly their right and their prerogative, but they were at least honest, and I give them credit for being honest. They were honest with the people. They said, we need $150 million more in taxpayer money to expand Medicaid on an annual basis. I don't think the taxpayers of Mississippi can afford that, and so I haven't changed my view and haven't changed my position on that. In fact, I ran on that particular issue in 2019. Everybody that ran against me was for Medicaid expansion, and so to a certain extent, I think we've certainly debated this issue considerably, and I think the vast majority of Mississippi voters are opposed to it.
Medicaid already serves about 670,000 Mississippians' poorest, most disadvantaged citizens, and state government already gets a huge amount of support from Medicaid. Mississippi currently gets the highest federal match for Medicaid spending or FMAP in the nation. The national average is 56%, but for the Magnolia State, the current rate is 84.5%. For every $5 the state pays for Medicaid coverage, the federal government reimburses the state about $4.22. And with the passage of the American Rescue Plan, that FMAP would be raised by about 5%. Our state would get an additional $600 million in federal incentives, or over 2 years, if we expand Medicaid coverage. As many as 300,000 more Mississippians could finally get health insurance. So, Governor, do you still think that's an unreasonable deal?
I still believe that when you look at the overall impact to Mississippi, I'm planning to be here longer than just the next 2 years. There's no doubt that the American Rescue Plan, which, by the way, only spent about 10% of the total money of the $1.9 trillion that the federal government spent on actual COVID-related expenditures, but of the entire $2 trillion, about 10% went to COVID-related expenditures, and everything else went to a very liberal left-wing wish list that the Biden administration had asked for. When you look at the incentives for those 13 or 14 states that have not expanded Medicaid yet in our state, they definitely provide incentives in the short run. But what happens in year 3? Or what happens in year 5? Or what happens 10 years from now when it's costing the taxpayers of Mississippi hundreds and hundreds and hundreds of millions of dollars more to pay the state share, because none of this money is free. This money has to be paid for. It has to be paid for by state taxpayers. It's going to cost our taxpayers significant amounts of money, and I just don't think those working Mississippians that are doing everything they can to feed themselves and feed their families, that their taxes ought to have to go up to pay for Medicaid for others.
Are you concerned about the ballot initiative that's in the works right now?
Well, certainly we have an initiative process in Mississippi, and I think that if all parties that are included and involved in that initiative are honest with the taxpayers and tell the taxpayers the truth about what this is going to cost them, then I think you'll see an outcome not unlike what we saw over the last several years.
Here's another question from the hashtag Ask Reeves. Talk about what is the state doing about health care in the state? Do we have lost hospitals across the state? Dr. Dobbs, what about the rural hospitals that we've lost? What are we doing as far as showing up hospitals and our rural hospitals?
Yeah, and a lot of that's kind of seriously beyond my pay grade. You know, that's a huge thing. It's obviously a multi-billion-dollar industry. Rural hospitals are struggling for a lot of reasons. One of the reasons is going to be because they're employment-based. You know, rural areas are shrinking in some ways and not having the services, the outpatient services that, you know, the reimbursements have gotten tight. And when we've done analysis and we've looked at, like, what is the payer mix in rural areas, it's a lot more government payers and a lot less commercial. That's actually the biggest thing. There's a lot less commercial insurance in rural areas to help support the infrastructure. And, you know, this federal money is it's not a profit margin really built into that hardly. And then with the Affordable Care Act, they actually cut the Medicare rate out significantly to pay for the rest of it. And so a lot of places that are depending upon Medicare for reimbursement are actually working at sort of like below cost sort of reimbursement. So you can only lose money so long, you can't make it up in volume.
All right, Melanie has another viewer question. Mel?
Thank you, Byron. Yes, this is from Eleanor S. She says, please ask Dr. Dobbs if he thinks that the COVID vaccine will become an annual vaccine like the flu vaccine.
Dr. Dobbs?
Yeah, I don't really think so. And a lot of it has to do with the biology of the coronavirus. It's very different. It doesn't mutate in the same way as the flu virus. So I think what I might say is I wouldn't think that we'd have sort of like an annual seasonal thing, but might we have an updated booster? Like if we get a variant that seems like it's specifically difficult to be controlled by the vaccine, we might get a booster, but I don't think it would be something that would be sort of like a regular sort of thing. And, you know, knock on wood, it's going to be a never sort of thing. We can all get vaccinated, we can just display some, minor sort of modest behaviors, and let's just let this thing fade away.
We know that the state was able to funnel some of those federal funds into state education. The new budget increases K through 12 funding by about 2.8% from last year, and higher education by about 7 to 8%. We have a couple of education-related questions from our viewers. August L. writes, why is there no discussion about the quality of public education? By any measure, public education and educators are failing. And Michael T. asks, with the aged facilities in Jackson Public Schools, do you have a strategic plan to build new schools? And Governor, what is your plan for bolstering and supporting public education in Jackson and across the state?
Well, first of all, I want to commend our legislative leadership for doing exactly what I encouraged them to do and sending me a teacher pay raise that I was proud to sign into law this year. Our teachers and our educators have probably had it worse than anybody else in this entire state of Mississippi in terms of them having to go over and beyond working with our students. Because remember, we went March and April and May of last year where we had to basically shut down schools. And it was a very difficult time. I said at the time it was the toughest decision I've ever had to make. I think it was the right decision given what we knew at the time. But we also worked extremely hard to make sure that we had plans in place such that we could reopen schools in our state in early August. We kind of take that for granted in Mississippi, and a lot of the people take it for granted. But about half of kids across America either are not in school yet or have gotten back in school within the last month or so. And so we really have been fortunate, and our teachers and our educators have stepped up and gone above and beyond, and I want to commend them for that. I'm proud of them, and while we'll never pay them what they're really worth, because the fact of the matter is they've done tremendous work. You look at our educational attainment in our state, the last 10 years has actually been a miraculous time in Mississippi. Look at high school graduation rates, for instance. High school graduation rates 10 years ago were at about 72%. Today, we have exceeded, and we were last. We have exceeded the national average in high school graduation rates in Mississippi today, and we're closer to 90%, just slightly below 90%. The movement over that 10-year period is incredible. You look at our 4th grade reading and 4th grade math scores. You look at our 8th grade reading and our 8th grade math scores, and they continue to increase on a relative basis. And I'm so proud of that occurring. We've got more work to do. All of our school districts are not equal. Some of our school districts are doing a better job than others. And we've got to continue to find ways to incentivize them to continue to improve. And I'm committed to doing that because our kids are so very important.
Director, as we're getting near the end here, talk to us about what you want to see as far as the resources that you need when it comes to dealing with these types of emergencies and what maybe you've learned from what's been happening.
Well, we've been able to purchase a warehouse to put back enough PPE for any type of pandemic that might come along. That's where we struggled in the very beginning as we were fighting not only the other 50 states, but we were fighting other countries for those precious supplies. And I think having those on hand, having those out in the communities as well, issuing almost 7.5, almost 8 million community masks out in the public, that hedges our bet. That lets us get further along in recovery, further along in vaccination, and concentrate on those areas where we can actually make a difference in the hospital rates and others.
Dr. Dobbs, some final thoughts on what you would like to see Mississippians do or what needs to be done as we deal with this pandemic in the rest of 2021?
You know, enjoy the path to normal, but enjoy it gradually, right? Get vaccinated, stay informed, love your family, right? Move out a little bit, but still show a little bit of restraint. You know, a little bit of mask in public, avoid large indoor social gatherings. But I think it's okay to get vaccinated, to go outside and play baseball and have outdoor gatherings with your family. But let's do it gradually, right? We're doing fantastic, but we're not done yet. And we don't want to have another wave. We don't want to have another surge. So get vaccinated and some common sense sort of safety protocols, and let's get back to normal.
Governor, your final message to Mississippians and what they should do?
Well, Byron, thanks for having us on today. I think this has been really good for the constituents across Mississippi. My final thought is this. I couldn't, after the last year, I never imagined coming into the governor's office and dealing with this type of pandemic. But I'll also tell you that after seeing the response by so many of my fellow Mississippians, I've never been prouder to be from Mississippi. And I know there are a lot of people around the country that talk bad about us and push down on us. I'm going to tell you, we have made a difference in people's lives, and we have stepped up, and it's a credit to people in all 82 counties, of all backgrounds, of all races, and I'm just proud to be a Mississippian today. We got more work to do, but we have made tremendous progress.
Governor, thank you very much, and your guests and your team for being here. State Health Officer Dr. Thomas Dobbs, Director McCraney, thank you for being here. We're out of time for this broadcast, but watch a post-show report on our website, WJTV.com. My partner, Melanie Christopher, will have analysis with Dr. Timothy Quinn from Jackson's Coronavirus Task Force. I'm Byron Brown. For the governor and the rest of the staff, we thank you for joining us tonight across the state, and make it a good night, everyone.